All right, so we're going to talk a little bit about experimental design. So it's just essentially the scientific method. You've been over it a lot of times, but it's part of our curriculum, so we'll go back through it. So remember, um, it always starts with an observation, right? So um, so an observation or an observation or a problem that needs solving. So um, we're going to determine objectives. So what do we want to accomplish in this? We can brainstorm. We can do what's called fishbone, right? And we'll talk about that later. And then I've got to design my experiment, right? So we're going to go from here today, right? And then we're going to talk about how you conduct experiments and how you analyze data and interpret results. So let's get on to it. So variables, right? Variable types. So people get confused on variable types because we use words that don't really mean a whole lot. So an independent variable, right, is kind of like a measuring criteria. So it's not something I can change. It's something that is used to measure results with or measure results against. So most often it's time. But it could be um, the amount of reaction that's occurring. No, that would be the other one. But most often it's time. But we'll talk about that as we go. Right? So most often time. Dependent, or I'd like to say responding variable, is what you measure. Right? And it responds, this is the important part, to the manipulated variable. So right, that's the variable that's changed. And that could be plant height, bacterial growth, reduction in symptoms if you're doing a clinical study with medications, and all other variables are controlled variables. So a variable is any condition, right? It's any condition in the experiment. So if we look at here, right, if we look at this experiment here, we're looking at plant growth, right? So fertilizer here is my manipulated variable. All right, so that's my manipulated variable because you can see I give different amounts of fertilizer in each one. All right, this one right here would be my control group. Right, it's my control group because it didn't get any of the agent, right, that I'm testing. So that's my control group. But if I look at, so that's my manipulated variable, my responding variable, or if you're going to say my dependent variable, would be height. If you're going to look at my controlled variables, right, I could have plant type, I could have the amount of light, I could have the soil type, I could have the pot size. So anything that is the same with everybody, right, including my control group, is going to be a control variable. All right, so setting up an experiment. In biopharma, right, I'll always have an experimental group, right? So this, they're getting for instance, someone getting the new medicine in my control group, right? maybe some getting the placebo. And the placebo they call a sham treatment. Right, so they get salt water instead of a medication in their injection. All right, so the difference between the two. Right? Interestingly enough, there's a thing called the placebo effect, and some people get better on their own, and they think they feel better because they get the placebo. All right, so if you look at this experiment up here, all right, I just noticed this the other day. I've had this slide for a couple of years. I have a group of patients suffering from depression. Oops. I lost my pen again. So I've got a group of patients suffering. There's a problem with this study. I don't know if that's too thick. All right. So group 1 gets the drug therapy and psychotherapy. Group 2 gets drug therapy. And group 3 gets psychotherapy. All right. So the problem with this is I've got too many groups, right? If you just did this, well, the problem with this study is group 2 shouldn't be here. And this should be plus placebo. Right? Because I can only, you're changing two things. You can only change one variable. Right? So I have to have one variable, right? But I have to make both groups, right, think they're getting the same thing. Right? Most tests are what they call double blind. So blinding is so blinding is making a group unaware of who's in the control group and who's in the active group. Double blinding, right? So in double blinding, most studies are called double blind studies. Both the physician treating the patient and the patient are unaware whether they're in the control group or they're in the active trial group. Right. So we do most, and that removes biases. Right. So that the people doing the study will look at both sets of groups differently. So we'll evaluate the results unbiasedly. All right. So here's an example. We were supposed to do a cheese curdling lab. So cheese making is probably in the high 90%, all based on biotechnology. So there's a cheese curdling agent, right? So curds, right, are clumps. So when milk starts to spoil, right, bacteria create curds. Right, so bacteria create curds, and those are the lumps that form in milk. Right? If you remember the old, I'm trying to get my pen to work again. So if you remember the old Miss Muffet, little Miss Muffet of Nursery, so they say curds and whey. Right, whey is the sour liquidy. So these are the solid clumps. And whey is the kind of the sour liquid. So milk will curdle on its own based on lactobacillus. It's a bacteria in it. But it takes a long time, right? So there are curdling agents. So in the guts of calves, right? The calves will drink the cow's milk, and they have an enzyme that they produce when they're calves that make the milk curdle, so it's more solid and it can be processed better, right? So renin is an enzyme produced by the calves. So originally they used to have to harvest it from the guts of calves and goats and yaks or whatever they're making the cheese from. And they could use that, and then they would use a part of that cheese with the enzyme to make a new cheese, to make a new cheese, to make a new cheese. All right. But we figured out we could have bacteria make a form of it that we call chymosin. So bacteria can make chymosin, right? Which does probably just about as good a job, right? Sometimes better. Chymosin usually makes soft cheeses, and renin usually makes hard cheeses. But you can make hard cheese out of soft cheese. You just have to compress it and age it and cure it, right? So if you're going to do a test to figure out which curdling agent does a better job at making cheese, right? So I could give you a question like this. So if I was going to do this, I'm going to take 6 centrifuge tubes, not 4, right? Each is going to get 10 milliliters of buttermilk, right? Buttermilk makes good cheese, it's thick. I have tubes 1 and 2 are going to get renin, 3 and 4 are going to get chymosin, and then 4 and 5 are going to get DI water, right? Okay, so my manipulative variable, right, and this would be curdling agent. Right, so it'd be curdling agent. My dependent variable, right, is going to be time. It's not going to be time. It's going to be amount of curds. That's what I want to measure is curds. My independent variable then is going to be time. And then you can talk about controlled variables, right? Things I'm not changing. So what's the same in all the tubes? We have tubes. We have buttermilk. We get some temperature. Right, so stuff like that. My experimental group has the curdling agent. And my control group has the DI water. Right. And we add the DI water so the volume is the same in H. Right, so we can put volume here as a controlled variable. Right, so that's how I would set up an experiment. I would do the experiment based on that. All right, so pretty quick, pretty easy. I will talk to you soon.